Thank you very much to Mel Dixon, who has agreed to talk to us about her experience of having 2 children with a rare disease and going through the process of genomic testing. So, Mel, I just want to ask you a few questions. And the first is, can you just describe to me what took you to seek medical advice? I think initially for your son and then later for your daughter. So could you just talk me through that a little bit?
Yeah, sure. Thank you for having me. It was my son was obviously my first. He was my firstborn, so he was quite late with his developmental milestones. He was a difficult feeder. We noticed he was quite clumsy, but then my dad's quite clumsy. I'm quite clumsy, so we put it down to that. Then he was a late talker as well, so he was late with developing his any vocabulary. He was quite slow to develop, but not massively slow. That's sort of a few months behind other children. So we noticed sort of a pattern of developmental delay, but relatively mild, I suppose, compared to some cases. But then I think at about age 4, we noticed that he had a slight tremor in his hands when he was going to do things, like the fishing games, gross motor activities. We just noticed this slight tremor, and really, we just over the years sort of thought the tremor was getting more noticeable. We noticed it, when he would wake up, it would almost be like his whole body would shake. So we just noticed an increase in that. And then my daughter, I've got a middle son as well, who's unaffected, but my daughter presented with very similar symptoms very early on. And actually for her, I noticed the shakiness from birth, when she was going to try to grab things, there was a slight tremor, or she was excited. We noticed that. So I think that was always the anomaly, that didn't fit into just a developmental, not just, but a developmental delay pattern.
Thank you very much. And it took a while, didn't it, for you to get a diagnosis? And that ended up with you going through this process of having whole genome sequencing for the whole family. Can you tell me a little bit how that felt, waiting for results?
Really difficult. We knew, I know you're told not to Google, but we had Googled, so we knew we were potentially facing some very difficult diagnoses. We'd been through genetic testing privately that we paid for in 2017, which had come back negative, and they'd had quite a lot of extensive testing for that. So in a way, probably naively, I hoped that these results would also come back negative. But now I actually realise, although our disease can be progressive, we're lucky that we've got an answer, because we've got something to act on, where there's other people, just because it doesn't come up straight away doesn't mean that it's not going to get worse. So from that point of view, although initially very, very difficult, and I think the first month it took a while for us to digest the information, and to be told that there was a neurodegenerative aspect to it was obviously not the news that any parent wants to hear. But as I learned more about it, I feel I gained more hope for the condition. Rather than just sitting there watching my children's tremor get worse, I could actually now try and intervene and take some level of control over what's been an uncontrollable situation for really. I mean, my son got diagnosed when he was 13, I think, so it had been a bit of an odyssey to get there.
But I think that's very common, that particularly as technology is advancing, many people will start off with no diagnosis, but actually often when we go back and look, so that's really interesting to know that you'd had the private testing before, because often when we do go back in the light of new knowledge, we find things that were there in the testing data, but we didn't know the significance of it. And so the result of the genetic testing showed that both your children have this genetic condition caused by changes in a gene called DHDDS. And we didn't know very much about that at all when I gave you the result. How did that feel, knowing that you've got a rare disease that's really rare, or maybe less rare than we thought now, but about which we I wasn't able to tell you very much at the time.
Really difficult. So again, we resorted to Google to have a look, because you can obviously access these scientific papers that have been published, and we found the biggest case study by Dr. Serena Galosi, which was of 25 patients with the condition. And in that case study, she again refers to it as neurodevelopmental and neurodegenerative.